Tonight, let's dive into something really exciting. Welcome to the latest episode of the Minor Talk series. Thank you for joining us tonight. Our theme for this session is Roadmap to Choosing a Medical Specialty, a little compass to guide us in medicine. My name is Yuek Feng, and I'm your host for tonight. I'm really excited to be here, and I hope all of you will take away useful insights about your own journey in medicine. Before we begin, I would like to introduce our amazing speaker, Dr. Andrew Low Zhijian. He's an ophthalmologist with a strong background in the field. He first completed his MBBS in Belgaum and later continued with a Master of Ophthalmology at Universiti Malaya. He also obtained FICO, which stands for Fellow of the International Council of Ophthalmology, and Cert of Royal College of Ophthalmology. We are very honored to have Dr. Andrew joining us this evening.
Thank you.
It's great to have you here, Doctor, and we can't wait to hear your insights. So, without further delay, let's get started with our first question. Dr. Andrew, could you share your journey to becoming an ophthalmologist and what inspired you along the way?
Okay, first of all, thank you, Yefeng, for the very kind introduction. I'm really happy to be here with all of you, and I still remember being in your shoes too. Excited, unsure, a bit confused. I hope my story today can help you feel a little bit more confident of your own journey. Okay, so for the first question, my journey as an ophthalmology. Well, to begin with, you don't have to figure out everything at the beginning because it can be very daunting. What matters most is being open, curious, and follow what inspires you. So for my story, I didn't really plan to be an ophthalmologist. I sort of found it along the way. Well, it's a long story, but I'll try to summarize everything for you guys. So basically, I'm from Penang. I was born and raised in Penang. I went to Chongling Batuof High School. The typical Asian upbringing, academic first, curriculum, being the head prefect, school band, volleyball. So back then, I got, not to brag, but I got straight A's for all my exams. And back then, the mentality or the idea was very simple. You get straight A's means you do medicine, you be a doctor. So I got JPS scholarship to study medicine overseas. Back then, it was equivalent to like getting a jackpot of almost R1 million back then. But the truth is, I never actually dreamt of becoming a doctor myself. I wanted to be a scientist, inventor. None of my family members or relatives were doctors back then, so everyone was very excited when I got that scholarship. So I didn't have everything figured out, but I took it as a sign that it was part of God's plan. I went ahead, completed my medical school, and fast forward to my housemanship. I wasn't aiming to be a specialist, to be honest. I was basically exploring life during that time, doing locums, trying out new things like studying an online shop, even setting up a music academy with my wife, and doing all kinds of things besides being a doctor. Because for me, being a doctor is just part of my life. It's not the whole thing. I'll get to great details later on, but the the whole thing is you don't have to figure everything out at the very beginning. So I sort of discovered ophthalmology quite late, actually. It was during my M.O.ship. And during my housemanship, I didn't prepare or didn't took any exams for ophthalmology or any entrance exam. But ophthalmology was something that actually very fitted well for me because it was surgical based, it was balanced, and it has instant patient satisfaction. So, I mean, for you guys need to know whether you want to be in surgical base or non-surgical base, which I'll touch on later on as well. So for ophthalmology, you can actually restore someone's vision and sometimes within minutes and they can see the world again. So it's very deeply fulfilling. So for part two of your question, what inspires me to be an ophthalmologist? The very honest answer is my inspiration kept changing as I grew. When I was a junior doctor, the inspiration was actually very simple. I wanted a specialty that matches my core values, which is surgical base. I wanted a life outside the hospital, and I wanted to make an impact. So these three things were what guide me to my sort of like to be an ophthalmologist. And ophthalmology gave me all three of that. It gave me space to be a doctor and still be a human. And that inspiration grew with me. Like today, I'm a specialist and I operate almost every day. And what inspires me today is different from what I was back then as a junior doctor. But what I can say is inspiration is not a sort of like a one-off thing. It's not like motivation, like you get it one time and just forget about it. It's an attitude that you develop. If you train yourself to look for meaning for everything that you do, be it a medical student or houseman or MO or specialist, you always find something that can inspire you and keep you going. So you can choose to focus on your stress or you can choose to focus on your purpose, but the mindset is very important. So to all those who are listening here, don't worry if your path isn't straight. Let your curiosity leads you, and sometimes the specialist, the thing will come up along your way. Okay, Yefeng?
Wow, doctor, that's really cool. I love how you turn those unexpected experiences into motivation and even started sharing your knowledge with others as a medical influencer. So, looking back, what advice would you give your younger self about choosing a career in ophthalmology? Did you ever face doubts or pressure, and how did you handle them?
Okay, thanks for the question. I realize your questions are very action-packed. It's full with questions, and I really like it very much. So, looking back now, what I'll tell my younger self is, you don't wait for the perfect timing or you don't wait for approval. Always take initiative and be proactive, because there will never be a perfect time. I remember, as the saying goes, it's either one day or day one. If you keep saying one day, you keep waiting and procrastinating. If you say day one, means you take action and you start going. So let me give you a real life example. So when I was a medical officer, I was placed in general surgery department. If you know general surgery, it's very busy and it's very hardcore. I had to do 8 active calls and 4 passive calls per month. So basically, it was crazy. You need to take care of the ward, go to OT, take care of ED, and the calls are very demanding. So basically, I was like living in the hospital, literally like a sleep deprived zombie. So there were nights where I thought of quitting as well. Maybe like opening a clinic, because I had offers to join a GP, even start up an aesthetic clinic, or even starting a nursing home. But I was very confused at the time because I felt that I was very lost in my own calls. I didn't have time for myself. And basically, when I was a surgery MO, it's like very demanding. And especially when I see my friends progressing in their careers, especially those non-medical friends who are very established in life, I felt myself was just like trying to survive another on call. So I sort of faced pressure and stress from all directions, and I was really lost. And I even asked myself whether this is worth it. And I believe that every true doctor, in fact, all of us, all of you will actually ask this question to yourself one day, because being a doctor is not easy. Yeah, especially you have to go through a housemanship, MO-ship, and climbing from the most junior bottom to be a specialist. So what I realized is you need to take action. So when I was in general surgery, I was actually quite, I would say, quite depressed. And so I studied very hard to take my ophthalmology entrance exam, worked very hard for that transition to happen. So I was being very tired post-call, even take coffees to study. And here's what many people don't know. In Malaysia, you actually don't get to choose your specialty, because when you're placed in a hospital, whatever the hospital lacks, or if there's a need in a department such as medical, ED, surgery, or ONG, you'll be placed in that core or that essential services first. Means even if I wanted to be an ophthalmologist, I mean, if I want to be in ophthalmology, if I wanted to go to that hospital, if that hospital there's a lack of MO in other departments, you have to give your service first. So that's what I did. I was in surgery for almost a year before I get to change to ophthalmology. So what I learned was you have to be very persistent. You have to start doing things. So every month I would go to the Pengara's office to request for a transfer to switch to ophthalmology. So looking back, I would say I should have gone every week to be more persistent. So when I entered into ophthalmology, I found out that that 1 year in general surgery wasn't really wasted, right? It built my resilience. It trained me to stay calm in emergency. It taught me how to think under pressure. So just remember that when the door doesn't open, just try to knock louder, and don't chase certainty. Just chase growth. Whenever you are placed, every detour or every delay or everything that doesn't go your way, just take it as a part of growing. And I believe that is very good advice for you guys. Yeah.
Wow, doctor, thank you so much for sharing that so openly. I think a lot of students can relate to feeling unsure sometimes.
Yeah.
Doctor, I'm actually a bit curious. Did you ever consider any other medical specialties before choosing ophthalmology?
Yes, that's a very good question. Thank you, Yefeng. Unfortunately, in Malaysia, you can't try every specialty, but during your housemanship, you actually get to go through 6 postings. All right, medicine, surgery, ONG, pediatrics, orthopedics, and you can go either emergency or anesthesia. So I went through housemanship. I honestly enjoy it, and I love every one of it in their own special way, if you know what I mean. But when people ask me back then, which specialty you want to specialize or which one do you like most, I couldn't really answer them. I didn't hated any one of them, but I didn't find that, what you call it, that burning passion to do it. And I almost considered ONG because I really enjoyed my time there, but I couldn't see myself doing it for the rest of my life, so I didn't go into ONG. So the truth is, I had very little exposure to ophthalmology back then because it wasn't in the housemanship. It wasn't even under my radar. So it's very good that you guys are actually doing this, and I really want to say, you guys are doing a great job for organizing this insight and interviewing, this kind of things. I didn't have this back then, so I didn't know what ophthalmology was all about. So ophthalmology is a perfect balance of medicine and surgery. And it's also a very good balance between technology and art. And it requires a very delicate precision and you can get immediate results. Sounds good, right? Then I realized ophthalmology lets you change a person's life just by changing their sight. Sometimes many people don't realize how important their eyes is because just try to imagine you close your eyes and you can't see anything. Um, that's very, very scary. All right. So when someone loses their sight, they actually become very, very depressed, very, very down. And when you can help them to let them see again, it's life changing for them. Yeah. So if I could give advice to students choosing their path or choosing their specialty, don't just ask which specialty is most respected or most well paid. Instead, ask which specialty fits me the best? Like, how does the specialty fit into my life? And can you see yourself doing it for the next 20, 30, 40 years? And does it align with your strength, your values, and your lifestyle goals? All right. So finding the specialty is very important. In fact, it's still a very long way to go, but it's good that you guys are opening your eyes and seeing what you like and just choosing it in your mind. That's actually very good. Just remember, don't choose a specialty to impress others, not to impress your parents or your friends or anybody else. Choose a specialty that fits into your own life. Okay, Yefeng?
Yes, doctor, that's really interesting, I think, because exploring different areas can really help us to make a better choice in our career. Speaking of exploring, what should medical students keep in mind when learning about different specialties? And what are some common misconceptions, especially about ophthalmology?
Okay, thank you, Yefeng, for the good question. So, likewise, this question has 2 parts. So let me just break it down to 2 parts. So the first part was, what should medical students keep in mind when they choose a specialty eventually, right? So, if I could tell them one thing is that choosing a specialty is thinking about what kind of life you want to live. Because like what I mentioned earlier as well, medicine or being a doctor is just a part of your life. It's just a portion of your life. It's not your whole life. In fact, you shouldn't put your career or being a doctor as everything, as your 100% of your life, because you're gonna feel very stressed out. You're gonna feel um, like you're gonna be affected by it. So you have to try to prioritize your life and make it like part of your life. So when choosing a specialty, I always tell my friends or my juniors these 3 things. Does it align with your core values? And does it fit into your lifestyle? And does it create impact that makes you feel meaningful in life? Can I repeat again? So these three questions you should ask yourself every time. What are your core values? And does it fit into your lifestyle or the life that you want to build eventually? And does it create impact that makes you feel meaningful? Because if you chase after money, you're not going to feel meaningful. Eventually, you're going to feel depressed. All right, so you have to chase impact. So as my example, I was exploring different fields as well. I realized that being a doctor was just one part of who I am. So besides being a doctor, I love to travel. I love spending time with my wife and kids. I love creating things. I love to, be involved in making videos, even content creation and experimenting AI. So there are actually so many things to do besides just going to hospital and seeing patients and becoming a doctor. So you have to make your life balance. So my core value number one is I needed a specialty that has balance, which means allowing me to serve people and yet have space to explore life beyond medicine. So that was one of my core values when I chose a specialty. Of course, you can choose any specialty, but make sure that uh, your core values are right. My core values may not be same as yours, Feng, or may not be same as our listeners here, but for me, it's balance. And that's why ophthalmology makes sense to me because I can help people regain their sight and I can change their life, and yet I have room to breathe, to grow, and to spend time with my family as well. And ophthalmology is also one of the very few specialty that you can actually go on a mission trip, which means you can go to a remote community and perform surgeries, do cataract surgeries, and help hundreds and thousands of people, and then come home to your family as well. Not many specialties can do that, but in ophthalmology, we can actually be involved in, we call it like a global like outreach or global health kind of initiative like Orbis. Yeah. So coming to the next part of the question is common misconception. Yes, very important. Many people think that ophthalmology is a very niche and a very quiet field. Like they think that it's a very boring thing, just two eyeballs and not as interesting as cardiology or neuroscience. But then ophthalmology is one of the most high impact and most rapidly advancing specialty because every month or every year we have new technologies. Like we have a lot of machines. If you like machines, ophthalmology is the way to go because we have a lot of laser machines. Like literally we're like playing video games. Like we are aiming at part of the eyes and we're going to shoot on it, and we do surgeries and we have all kinds of machines and all kinds of new technologies of like intraocular lenses, you have implants, and it's very exciting. And we have a lot of conferences, be it local or international, where uh, like companies will come up with new advancements, and it's just very amazing. I'm just so happy to be in ophthalmology because it combines technology, microsurgery, and all kinds of exciting things into this specialty. So if you answer those three questions I mentioned above, you will definitely find the right specialty. So for me, the combination of surgical base, balanced lifestyle, and to create an impact with the people around me, all those three combined core values outweighs any challenges I face in ophthalmology. Because in ophthalmology, uh, it's not easy. I'm saying it like it's very easy, like everyone can do it, but the learning curve is one of the highest. I've seen many juniors come into ophthalmology. The very first week, the very first month, they'll be very lost because they have no background or experience in ophthalmology, and the learning curve is very high, which means you need to learn how to use the slit lamp, you need to use the BIO, and there's a lot of things to learn in ophthalmology. And the, the, the learning curve, I would say, is like almost vertical. It's very high. But once you cross that learning curve, you'll be fine. So, so make sure that when you choose a specialty, make sure it aligns with your core values. And eventually, I found out that ophthalmology is not just a career choice for me. It was sort of like a perfect life fit. So every day when I wake up today, I feel so excited to go to work. I'm not kidding. Yeah, so I encourage all of you to just look into your life and just see what you want in life and find a career that suits you the best. All right, Ifong?
Wow, doctor, that's really helpful. So, It's great to hear what's the true meaning of pursuing different specialties and what we don't usually see or expect from ophthalmology. And that makes me think that many students nowadays value work-life balance when choosing a specialty. In your opinion, how can they find a good balance between lifestyle, passion, and long-term satisfaction?
All right, thank you for the question. That's actually very true. In fact, doctors back then and doctors nowadays, we have different priorities, I would say. So I hate it when people say, okay, when I was a doctor back in my old days. So I don't actually agree with that. But yeah, you very well mentioned that work-life balance is very important. And I think balance is it's not something you find. Balance is something you have to build by yourself. It's like you first of all you need to know your priorities, which means you need to know what's most important for you and what you want in life, and then you rearrange those priorities. Uh, there's no balance in life, to be very frank, and you can't say that okay, I work 10 hours, I want 10 hours of break, I want to go traveling. I work for 2 months, I want to go travel for 2 months. There's no such balance. It's like I on call for 2 days, I want to spend 2 days with my family and kids. There's no such thing. So the only thing you have is to know your priorities, right? So when I was younger, I thought that being a doctor is like uh, giving everything to your job, like long hours, constant on call, sacrifices. But over time, I realized that if you lose yourself in the process, that's not service anymore. That's self-neglect. Yeah. So for me, ophthalmology became a bridge between, I would say, purpose and peace. Yeah, peace with myself. So it allows me to be a doctor, a surgeon. I love surgery. A doctor means I can have a clinic, I can consult patients, I can meet patients, because some people they don't like patient interaction, so they can do non-medical work. But for me, I love to talk to people. I love to talk to patients. So being a doctor is top of my list. Being a surgeon, I wanted to do things with my hand. So being a surgeon is top of my list. It allows me to be a husband as well, a father, and also a creator. So you need to find that sweet spot when you can let your work feed your soul, so to say, which means that work-life balance thing, you have to rearrange your life and find that spot. Everyone's spot is different. Some people wants to be a hardcore surgeon, want to be like living in a hospital for 24 hours. That's fine. It's not wrong. Some people wants to be more focused on family, so they go to do other careers or besides being a doctor. That's fine as well. So everybody is different when it comes to work-life balance. So my advice to medical students or to our audience is, when you think about balance, don't imagine of equal hours. Imagine putting your priorities in the right places that gives you fulfillment in life, which means first you list down your priorities in life. It could be different for everybody, and then you rearrange them and make sure that it makes you happy and it makes you have fulfillment in life. Because in real life, in reality, there's no balance. So the real definition of balance is not the absence of hard work, or you want to rest more than you work, or you want more enjoyment. The the definition of balance is you need to find the presence of meaning in your life. So once you have meaning in your life, once you have purpose, everything, even though some days I do admit that I work more than I play, but even when I work, I feel fulfilled. So it's not like you work more means you're being sad, and you play more, you're being happy. So you need to find that meaning and that bridge between your life to have that so-called work-life balance. I hope that answers your question, Yafong.
Thanks, doctor. That's really practical, I think. It's good to know balance depends on the person and, most importantly, enjoying what you do. So, thinking a bit earlier, what advice would you give to a pre-university student who dreams of becoming a doctor one day?
Okay, thank you for your final question. And I feel it's a very good question. But I would like to start off by saying that it's okay not to specialize too. I know I've been talking about ophthalmology and all kinds of specialization, but it doesn't mean that you have to be a specialist to be successful. Many doctors, I have many friends who are not specialists and they are doing very, very well as well. So don't be discouraged if you uh, don't specialize or you don't find the right specialty that fits into your core values, or if you have other priorities in life, that's fine. But becoming a doctor will actually change your life. Not only change your life, but it will reveal who you really are. So for those pre-medical students going to study medicine or even in medical school, just know that it's not all about memorizing books or getting straight A's or getting the highest score. In fact, that's the easy part. Okay, to get into medical school to study and take exams, you might feel that it's one of the hardest thing right now. But looking back, that was the sort of like the easy part. When you come to the real world, when you go out to work in a hospital, when you start your housemanship, um, everything is different. Yeah, I'm not to tell you so much negative things about it, but just be positive in everything that you do. So you're gonna feel you're gonna face pressure, you're gonna feel self-doubt, and you're gonna feel down, but just don't be afraid of uncertainty, because those are the time where you actually grow. Okay. So clarity doesn't come from knowing everything at once. Remember, when I first started, I told you that you don't have to figure out everything as a medical student, but you just have to have some knowledge about it and take one step at a time. When the time comes, things will start falling into place. And eventually you'll find a specialty that matches your value and not just your ego or your or other things which are not too important. So always choose a path that excites you. You know what I mean? Like make you excited to go to work and also allow you to be the person that you want to be inside and also outside the hospital. So for me, ophthalmology became the balance where I found a space to serve and to create and also to travel, to spend time with my family and to make an impact with people around me. And I would advise students to not only chase perfection, but to chase purpose and don't wait for the right timing. Take actions and create the moment. And looking back, every challenges that come in your way or everything that you face, uh, just know that nothing is impossible and always believe in yourself. And last thing I have to say is medicine is not just a profession. It's a very long journey. In fact, now I'm still learning, I'm still growing. It's a very long journey of becoming not just a better doctor, but also a better human being. So I hope all these stories and some experience um, by sharing with you guys may encourage and inspire you guys to be better doctors and better human beings. And don't be afraid of being a doctor. And I'll be sharing a lot of my stories and experience in my Instagram as well. So do get in touch with me. I'll be happy to guide you guys over there as well. So thank you so much for this interview, and thank you, Yefeng, for your initiative and all the questions. I believe that it's a very good thing that you guys are doing. Okay, thank you.
Thank you so much, Doctor, for your good advice, and I'm sure this will help our younger audiences who are just starting their journey. Once again, thank you so much, Dr. Andrew, for your time and for sharing your experiences so openly. I think many of us leave this session with a clearer and more realistic view of how to choose a specialty and what the journey in medicine actually looks like. To everyone in the audience, thank you so much for spending time with us. Take care, stay safe, and we will see you at the next Minor Talk series. Have a nice day.